You're jamming to our theme music.
So welcome back, listeners. Today we dive into a very hot topic, anemia. And we're so excited to have with us a global anemia expert and author of the book Bloodworks, an Owner's Guide. This has been described as the most exciting book on blood health, and everybody is just talking about it. And we're so appreciative and happy to have Dr. Irwin Gross here with us today.
Yeah, there are thousands of people out there in groups online trying to get help for their iron deficiency. And they're asking on these online forums, why can't I get an iron infusion? My doctor isn't helping me. I don't know what to do. And so I really want to talk to Dr. Gross about helping our listeners to understand the pandemic of anemia and also how to talk to their healthcare professionals to get what they need.
Yeah, that's a great idea. We'll definitely get into that with him. So how about let's get Dr. Gross in here, Sarah?
Sounds great. Good evening, Dr. Gross. Thank you very much for accepting our invitation to speak with you about Bloodworks, an Owner's Guide, the book that's newly released. We hear a lot of buzz about this on social media. Everybody's excited to be getting their book. So congratulations to both you and the 48 contributing authors.
Yes, so exciting.
Good evening. Yeah, good evening. Nice. Thank you for the invitation. Much appreciated.
Where are you joining us from today?
I'm joining you from my home on the coast of Maine in Brunswick, Maine, which is a small mid-coast town, about a half an hour or so north of Portland, Maine, which most of the listeners are probably familiar with.
Very nice. Yeah, we'll have to get up there one day. Dr. Gross, tell us a little bit about what you do in your spare time when you're not working in patient blood management.
Well, I enjoy the outdoors. It's one of the reasons why I moved to Maine and why I live here with my wife now and a daughter nearby with her 3 children, 2 other daughters
Nice.
down in the Boston area. And then our far-flung daughter out in San Francisco with her son. We enjoy the outdoors. We do a lot of hiking. We like to sea kayak, and my wife and I are avid road cyclists. In fact, we own a tandem and have cycled on the tandem for many years. We probably have about, somewhere between 25 and 30,000 miles on our tandem since we first started that.
Oh, wow. I feel like we need one of those, Marianne.
Yeah, Sarah, we need to get a tandem. That'd be awesome.
Definitely.
Let's get right into this interview here. We know that you've done a lot of writing. You have so much work, excellent work in the literature, a lot of speaking. But this book, why is this book so important to you?
Well, I first got into patient blood management about 15 years or so ago. My training was as a general pathologist, but I did a lot of clinical pathology, primarily transfusion medicine, coagulation, and hematopathology, and enjoyed the patient contact. And that's what drew me to patient blood management at the outset. The book has been a collaborative work, a labor of love with Shannon Farmer and R.E. Shander, 2 people I've known for many years now. And the book itself is the first of its kind. We have 48 experts from around the world who contributed. The book was focused on empowering the reader. The goal was to provide the public with information that would make them full partners in their care. One recent reviewer said the book had life-saving potential, and that's very encouraging, not just to the 3 of us, but to all of the authors. And many of the reviewers commented on its readability, which was something we worked very hard to achieve, a book that was accessible to the general public, but we wanted to ensure that it had value to healthcare professionals as well. And I think we achieved that.
I would have to agree. I think that you achieved that. I found the book to be very in-depth with all the research. I loved that. But yet simple to read, and really all people can benefit.
Thank you.
So keeping in mind that many of our audience members likely have no medical training, and for many, English may not even be their native language, could you break down for us, in the most simplistic terms, what is anemia? Is it the same as iron deficiency? And if they're not the same, why are they often talked about together?
Well, they're not the same. It's really an excellent question. Anemia is, in the most simple terms, is too few red blood cells or red blood cells containing too little hemoglobin, or both. And hemoglobin is the protein that carries oxygen in the blood. So less total hemoglobin, which is anemia, less total hemoglobin than normal means less capacity to carry oxygen to the different organs and tissues. By the way, hemoglobin is what gives blood its red color. Hemoglobin contains iron. And if you don't have enough iron, that is iron deficiency, you can't make enough hemoglobin. And you end up with fewer red cells, or the red cells contain less hemoglobin than they normally would. So iron deficiency is related to anemia, but you can become anemic for causes other than iron deficiency. And in fact, if iron deficiency is present for a period of time, it can affect your health even though you are not yet anemic. In other words, you can have anemia without iron deficiency. You can have iron deficiency anemia, but you can also have iron deficiency without anemia.
Wow. Thanks for putting those in such simple terms. Sometimes we're in the medical profession and we can start rattling off statistics, or we can speak with medical terminology that just goes above people's heads. So really appreciate the simple terminology.
Yeah, thank you. And I think that's so true. And it's one of the goals of the book, of course, is to explain complex medical issues in a way that the lay population can understand.
So, Irwin, I can call you Irwin, right?
Absolutely.
Awesome.
I prefer that.
Great. So there's a statistic out there, more than 2 billion people on the planet have anemia, right? So how do I know I have it? That seems like so many people.
Yeah, let's talk a little bit about that, because I think that's a startling statistic in many ways, and one that many healthcare professionals are not aware of. About a third of the world's population is anemic, somewhere around 2 to 2.2 billion people on planet Earth. And another 1.2 billion are iron deficient. So when you think about that, we're talking about 40% of the population.
That is staggering.
Yeah, is either anemic or iron deficient or both. And the exact numbers of people affected are somewhat dependent on how we define the thresholds for both anemia and iron deficiency. But whatever your measuring stick, anemia and iron deficiency is a huge global health challenge, a challenge of epic proportion. So getting back to how you would know whether you're anemic or not, there are many symptoms of anemia, but all of them are nonspecific. That is, they can be symptoms of many things besides anemia. But if you have those symptoms, it should prompt an investigation for anemia. At least it should prompt a call to your healthcare provider and questions that would then lead to a more in-depth investigation. So what are some of these symptoms? Fatigue and weakness, for example, once again, very common, a manifestation of many ill health states, but certainly an indication of what might be anemia or iron deficiency. Shortness of breath, dizziness or lightheadedness, decreased exercise tolerance, palpitations, that is a feeling of an irregular heartbeat. But in many cases, the symptoms develop so slowly that the patient sees how they feel as normal when it really is not. And anemia is so common that it's become invisible to many doctors. That is, mild anemia is so common it's become normalized. You can imagine in a day-to-day practice of a primary care provider, nurse practitioner, physician assistant, where a third of their patients or more present to them with mild anemia, they begin to regard that as something that's normal. But of course, anemia, though very, very common, is not normal. And what happens is doctors often then pay insufficient attention to mild anemia. And this, in turn, reinforces the notion that the fatigue a patient may be feeling is just something expected and something that they should live with. And our book tries to address this misperception in a way that empowers the patient, that anemia is common but not normal. It's something that should be investigated, and it's something that can be treated.
And if I had anemia, how would it impact my life, or how does it impact the lives of the people who are having it?
Well, it can have a profound impact on quality of life and healthcare related quality of life. And it's not just the symptoms of anemia. As we mentioned earlier in our discussion, iron deficiency can occur without anemia. That is, early on, iron deficiency can present with the same kinds of symptoms that anemia has, but even before the patient's red blood cell count or hemoglobin level falls. Iron deficiency alone can cause these symptoms, but of course, if the patient's anemic, iron deficiency can worsen those symptoms. And there's some really interesting and specific symptoms that are associated with iron deficiency that are often a clue to iron deficiency and iron deficiency anemia. For example, iron deficiency is associated with something called pagophagia. What does that mean? It means a craving for chewing ice. And what I give, yes, is, and I'm not going to ask you, Marianne or Sarah, if you've had that symptom in the past, but I will tell you that when I give talks about iron deficiency and iron deficiency anemia, I often ask for a show of hands. People have had this unusual symptom of a craving for chewing ice, and invariably a number of hands go up, particularly if the audience includes a large number of women of reproductive age, because iron deficiency anemia, as we'll talk a little bit about in a few minutes, is very common in women of childbearing age because of menstrual bleeding.
Sure.
Another important symptom, and one that can be very disruptive in terms of quality of life, getting back to your question about how iron deficiency and anemia can affect one's life, is something called restless leg syndrome. Now, what's that? Restless leg syndrome causes unpleasant sensations in the legs and an almost irresistible urge to move them. And it can be incredibly disruptive to sleep. Restless leg syndrome has a profound negative impact on quality of life. And historically, it's been very difficult to treat, but it is associated with iron deficiency. And when it's due to iron deficiency, it responds very quickly, literally within a day or two, to iron replacement with intravenous iron. Yeah.
I know in our anemia clinic, we've actually treated several patients, and the number one cause that we found from their iron deficiency was their restless legs.
Yeah. And I'm sure that you've heard from them just how disruptive it is to their lives. Mm-hmm. Another symptom of iron deficiency and iron deficiency anemia is that it interferes with cognitive function. It makes it harder to concentrate. And obviously, this has a tremendous impact across really everything that one does in their day-to-day activities. We also know, and this is an important point, that iron deficiency contributes to poor healthcare outcomes in a diverse number of diseases, what we would refer to as comorbidities, that is, diseases that occur in concert with or accompanying iron deficiency, things like kidney disease, diabetes, heart disease, and if one treats the iron deficiency, the outcomes of these other chronic diseases actually improves.
Oh, wow.
Amazing.
There's also some recent information that suggests that iron deficiency in pregnancy can result in not just poor pregnancy outcomes, but can even affect the behavior and development of the newborn. So anemia and iron deficiency actually can have an impact not just on the patient who's iron deficient, but on the developing fetus and the newborn baby that's delivered some months later.
Wow. And I wonder if pregnant women going through their pregnancy are often educated about that, how important that is.
I think that's a really good point. And with 4 daughters and 5 grandchildren under the age of 9, I can tell you that I've had personal experience with the issue of whether obstetrics care includes a high enough index of suspicion about iron deficiency or
Sure.
developing iron deficiency during pregnancy. And of course, prenatal vitamins include a small amount of iron. Nevertheless, a significant percentage of pregnant women do have significant iron deficiency, and proper iron replacement is just absolutely essential, and oftentimes is not addressed even by experienced obstetrical providers.
Wow.
That's so frustrating. Yeah.
Absolutely.
So talking about the impact, it's not just on the patient, as you started to speak about there. Mia's story in the book was just so powerful. Irwin, and you personally treated Mia, and we've changed her name here for privacy issue, but what a moment when she returns and her husband says to you, "Thank you for giving me my wife back." Like, what an incredible moment.
It's quite a few years now since I cared for me in our anemia clinic. She was a bariatric surgery patient. Bariatric surgery is surgery that's done to help treat patients with chronic obesity that's not responsive to other interventions. The surgery itself interferes with iron absorption, and so many patients who've undergone bariatric surgery actually develop iron deficiency. And as we've talked about, iron deficiency can be associated with just profound fatigue. And in Mia's case, she literally stopped doing all of the things that she and her husband had enjoyed doing together.
Oh, wow.
Well, she came into our clinic. We diagnosed iron deficiency, treated her with intravenous iron therapy, typically with the degree of iron deficiency that we saw in a patient like Mia. We did at the time 2 infusions separated by a couple of weeks. And when Mia returned for her second infusion, her husband was virtually in tears and threw his arms around me and said, "Thank you for giving me my wife back," because Mia's entire demeanor at home, her ability to do things not just around the home, but outside the home, with her husband had changed that dramatically after just that first iron infusion.
Yeah, I've seen people in the infusion center. I like to go over there and see them because, boy, sometimes one infusion, it's like you gave them $1 million. Yeah.
How quickly they respond. It's pretty amazing.
Yeah, and just to underscore that, I want to mention a study that was published, about 10 years ago now, that looked at the impact of iron deficiency on quality of life in women. This particular study was specific to quality of life in women, and they used a scoring system to look at what is referred to as vitality scores. And women with iron deficiency had vitality scores not just lower than the general population, but lower than women with clinical depression, lower than women with heart failure, with kidney failure, and even lower than women with a diagnosis of cancer. So iron deficiency anemia and iron deficiency anemia, as was the case with Mia, can have a profound impact on one's quality of life.
And I want to kind of discuss that a little bit more with you, if we can, the importance of anemia and the impact on women. And I'll ask the gentlemen listeners to please don't time out. There's much more to come in our discussion, and we promise to get to you as well. But I did want to talk a little bit about Chapter 10, entitled From Periods to Giving Birth. If anyone needs to understand blood, it's women. And I'll share a quote from the book. It said, "Women should be encouraged to speak up if they feel their bleeding is excessive."
Yes, that's a really important quote in the book, and it underscores the fact that women often don't speak up. And the question is, well, why would that be? And I think socio-cultural and religious factors certainly play a significant role, not just in other countries, but here in the United States as well. An example of religious impact from my own background, Jewish cultures before the Common Era certainly, but it's still true in many Orthodox communities, required women to be physically separated from men during their period, a time when they were considered to be ritually impure. So these taboos surrounding menstrual bleeding run long and deep. And in the United States and elsewhere, menstrual bleeding is often a topic that can be difficult for many people, women and men, to discuss. But as important, if not perhaps more important, is that women are often not aware that their menstrual bleeding is abnormal or excessive. Their bleeding is normal for them, and they don't know to ask about it. They don't have a comparison that would inform them that their bleeding may not be normal, may in fact be excessive. And in fact, I'll tell you a story about a group of patients that we helped to care for, lived on an island off the coast of Maine. It was a large family, large kindred, as we referred to it, that had von Willebrand's disease. Now, von Willebrand's disease is an inherited bleeding disorder. There's an increase in not just things like nosebleeds or bleeding associated with surgery or trauma, but these many patients with von Willebrand's disease have heavy menstrual periods as well. Now, when these patients came to us to have their labs drawn for the diagnosis of von Willebrand's disease, did they have VWD or not? If you simply asked when you did a bleeding history, is do you have abnormal bleeding or heavy periods? Always the answer was no, because they had nothing to compare to. They bled about the same as all their other family members bled.
Yeah, that makes sense.
Yeah. So it's really important for doctors to ask the right questions, not just do you have heavy menstrual bleeding, but rather to help women quantitate how much bleeding they have each month, how many days of flow, how many pads or tampons in a day or per hour. Sarah and Marianne, do you have any other ideas as to why women may hesitate to bring this topic up with their healthcare provider?
Yeah, sure. I think you brought up so many good points there. And, I have on my mind that while women have made many strides, many still live in this standpoint of perceived or often real oppression, or they're in a caretaking role that includes taking care of everyone except themselves. We're so busy all the time and we have everyone else to take care of, but we forget to take care of ourselves. Also, as you mentioned earlier, you can compensate for the signs of anemia, and sometimes you just don't even realize it. You think you're just so busy and you're just so tired, and you don't think it's a problem. You just think that you're tired, and, or maybe you just don't want to notice really, because then you'll have to take care of it, unfortunately. Yeah.
Yeah, two things come to my mind, and they are also touched in the book, and you've touched on them here too. I think that as women, we live with a negative stigma around our monthly blood flow. And if a woman complains, we're being dramatic or attention seeking. If we're having a bad day, people question whether we're either menstruating or near our period. And so this stigma is not only perpetuated by males. As females, we apply this stigma to each other as well. So I think that we've created an environment for young girls and women to just soldier through and not complain about their cycles. Secondly, unless you've had a dramatic change in your blood monthly flow, I don't know how you would know that you were excessive if that was normal for you. And that's something that you brought out, Dr. Gross. So I do appreciate the tool that is in Chapter 10 that helps women to evaluate whether or not they bleed more heavily or abnormally heavy.
One way that we can help women and in turn the people who care for them is through education. That's what our book does. When people are informed, they are empowered then to speak to their doctor in a way that is entirely different and alters that patient-doctor experience. And physicians in turn respond positively to an informed patient who asks good questions. They're more likely to answer the questions in depth and at a level at which the question is asked. And in fact, confronted with information that may be new to them, and we hope that our book does that, we feel that doctors, physician assistants, nurse practitioners, and others reading the book are then more likely to dig deeper, find solutions in partnership with their patient.
Oh, yes.
Yeah, I think the education, just providing people with knowledge is a really great way to empower women to break through these uncomfortable moments and actually get the health care that they need.
Yeah, and in fact, in that in the chapter that we've been talking about, there's a box with 6 practical questions to think about, and that your doctor should be asking you about if you're a woman who's menstruating. Simple things, but that identify so much. And as we've discussed, so many people are not comfortable talking about questions like, do you have bleeding that lasts more than 8 days? Is your bleeding so heavy you have to change your pad or tampon every hour? And I want to emphasize that many of our chapters, not just this chapter, provide suggestions on questions you should ask your doctor. And in so doing, you will end up getting better care from your healthcare provider. Another example of that is in the anemia chapter, chapter 7, the topic we started our discussion with this evening provides 5 questions that guide a discussion with your doctor about anemia and iron deficiency. So there's some very practical parts to the book that should help as you interact with your healthcare provider.
I really wanted to commend you on the story of Sophia, young Sophia. She was 13 years old. And I really appreciated how her team of both pediatric and transfusion medical practitioners worked together to do what was in her best interest. So because of abnormal uterine bleeding, she had bled to a critical hemoglobin level. So her blood count was very low. But the medical team decided to first see what the cause of her anemia was. And she didn't have a disease that was affecting her anemia. She had just had abnormal bleeding, and she just needed replenished with good iron and folate and things that could make her rebuild her own blood. They really took into, when they were making their decision as to whether to give her a blood transfusion or not, the fact that she was a young teenager and those indirect hazards that could kind of affect her later in life when she wanted to have children. They decided to just let her build her blood back on her own. And that was a really great story.
Yeah, Sophia's story is an excellent example that first and importantly illustrates our ability as humans to adapt to anemia and iron deficiency over the short term. Like other mammals, there's not a reason to jump to transfusion as a first resort. And when a patient is otherwise healthy and stable, as was the case with Sophia, providing that patient with the building blocks that allow them to self-correct in terms of anemia by making their own red blood cells as opposed to receiving transfused red blood cells is a better way to go. It's also, in Sophia's case, a great example of communication between an informed family and receptive caregivers who chose an effective treatment and had a great outcome, an outcome consistent with the desires of the patient and the desires of the family. And I also want to point out that both Sophia's parents were involved, not just her mom. And it underscores the fact that, as was the case with Sophia's father, men need to try and understand the additional challenge that women in their lives face regarding anemia and iron deficiency because of menstrual blood loss and because of pregnancy. And men need to feel comfortable talking about it and providing support.
So speaking of men, is anemia, does that affect men too, or is it only a female thing?
It certainly is not just a female thing. There's an interesting evolution of the prevalence of anemia over one's lifespan. Until the age when girls begin to menstruate, the prevalence of anemia is about the same in boys and girls. And then about age 10 or 12 or so, the average age of menarche, anemia becomes increasingly more common in females than in males because of, as we've been talking about, menstrual blood loss and pregnancy. Yep. Anemia and iron deficiency, in fact, is about 3 times more common in females compared to males until about age 45 or 50, about the time that women no longer become pregnant and when many women enter menopause and their menstrual bleeding slows and stops. From that point forward, the gap in terms of the prevalence of anemia and iron deficiency progressively narrows, although there's still a slight female predominance in anemia that persists until about the mid to late 70s. And after that, anemia and iron deficiency is actually more common in males than it is in females.
Wow. So we get up to the year 70 and they get the last few years, huh?
Yeah. Sorry. Those are the data. There's nothing I can do to change that.
After hearing you today, Irwin, if any of our listeners feel that they may have symptoms of anemia, what do they need to do next? What questions do they ask their doctors so that they kind of stimulate their doctor to be thinking about their anemia?
Well, of course, I hope all the listeners consider getting a copy of Bloodworks and Owner's Guide, either a copy of their own or a copy from the library, and it will provide some excellent guidance in terms of having that conversation. I would say that, many folks are familiar with the idea that they should know what their blood pressure is, what their blood sugar level is, what their cholesterol level is. We've sort of incorporated that into the information that we all regard as important for us to know to be an advocate for ourselves and for our healthcare. I would add to that everyone should know what their hemoglobin level is. And so that's something that they ought to talk about with their doctor, make sure that they have a hemoglobin that's evaluated when they have their visit to the physician's office, and that they know that number and they know what a normal hemoglobin is and what a low hemoglobin is. And the same is true for iron studies. As we mentioned earlier in our conversation this evening, iron deficiency can actually exist before anemia develops. And so it's important to evaluate iron levels when you go to the doctor as well. So just like your fasting blood sugar level, your cholesterol level, you should know your hemoglobin level and your iron studies so that you can be empowered and take ownership for having anemia diagnosed and treated properly.
Yeah, that's a really great point because, many people just don't know and it's ignored by somebody, so they ignore it too. So yeah, definitely get a copy of this book, listeners, and it'll be very helpful. And one feature of this book that I think is really cool is that it's really never going to go out of date because the reference list will be continually updated. That's just so awesome. And how exciting is that for you as an author, that it has that sense of timelessness?
Well, it is. It's one of the exciting aspects of publishing books now during the era of ebooks. Obviously, updating books is much more difficult when it's only available as a print edition, which has been true for since the time of Gutenberg, right? But ebooks allow us to update the content in the ebook at regular intervals. And not just the references, but if there are major changes in care or breakthroughs in the field of patient blood management, these can be updated and incorporated into the ebook version as well. This ability to update references and the comprehensive reference sections themselves are also of particular value to healthcare professionals. It adds to the value of the book to healthcare professionals because it gives them an easy way to identify the primary medical literature to educate themselves. And because of this update of the ebook function, it's essentially doing a relevant literature search for them at regular intervals that will allow them to stay current with changes in the field.
Wow, that is a good advantage to the electronic version of the book. Dr. Gross, we want to really thank you for the impact that you've had on your patients. It's well reflected in the book. Yeah. And we're going to be talking more about the patient and caregiver relationship with Dr. Shannon Farmer in our next episode. But before we leave you, we would like to know if you have any final thoughts that you would like to leave with our audience.
In terms of final thoughts, I think that it's important for people, just like they are paying attention to their kidney health and their digestive health, that they pay attention to their blood health. That's something that historically we haven't paid enough attention to. I think we've always, at least since the time after World War II when blood transfusion became common and practical, have always regarded anemia as something that could just simply be treated with a blood transfusion should it occur, and something that didn't have that profound an effect on people's day-to-day lives. We now know that transfusion carries significant risks, that anemia is best treated by giving the patient the opportunity to manufacture their own red blood cells. And all of us need to pay attention to our blood health, and in partnership with our healthcare providers, make sure we have those discussions, and that this is something that we address in order to improve our well-being, our health, and our happiness.
Very well stated. Thank you so much for joining us today, Dr. Irwin.
Well, once again, thanks so much for the invitation. Much appreciated.
Sarah, how nice to have a father of 4 daughters talk to us about anemia.
It was.
So much experience, not just in the topic, but from the patient perspective, truly. Speaking of which, listeners, join us next time where we'll be talking with Dr. Shannon Farmer, along with a surprise guest, on real patient stories and how that contributed to the journey of creating this landmark book, Bloodworks, an Owner's Guide.
We're already looking forward to talking to you again next month. Don't forget to check out our description if you want to get in touch with us, or if you want to claim your special price on Bloodworks, an Owner's Guide, the book that everyone needs before they are a patient.
Yeah.
From the Let's Talk PBM studios, stay healthy and keep your blood pumping. Marianne, here comes your music.